Today I have my friend Jocelyn here. She is going to talk to you about breast health and breastfeeding concerns for the postpartum mom all the way through to the first year. This is so important because there's not a lot of information in the mainstream about our own health. There's a lot on how our babies are getting enough milk, but there's not so much focus on what to do for ourselves other than maybe get a nipple shield. So, Jocelyn, welcome.
Hi, Carly. Thank you so much for inviting me today. I'm really looking forward to have some time to chat with you and your listeners. So my name's Jocelyn Logan, and I'm a birth doula as well as a breastfeeding counselor. I've been a breastfeeding counselor for about 29 years, a La Leche League leader for 13. I'm not with La Leche League anymore, but I was a La Leche leader for 13 years as well. I've breastfed all three of my children for, if you add all the years up, it would be 14 years. So 14 years of my life as a breastfeeding mother. Yeah, it's a long time. And I also facilitate the Prince George Breastfeeding Cafe, the Prince George Breastfeeding Toddler Group, and support women who have chronic low milk supply as well. And then mentor other doulas as well for breastfeeding. And basically my community, this is what I do. So lactation was really one of my very, very first passions. And then I got into birth work after my time being in La Leche League as a breastfeeding counselor. And I really was, felt like I wanted to be a part of birth because I could see how the birth impacted the person or the breastfeeding person's experience when they went to be breastfeeding people. So how much of that birth experience really strongly impacted the person in the weeks and months afterwards. And I really just felt like I would like to make a difference or try to make a difference earlier in the game. So yeah, that's what really sort of got me into being a birth doula. And I've been a birth doula for about 27 years. And I continue to still every day of my life read about breastfeeding and birth every day. I'm still excited about it, and I love sharing information about it. I love cheering people on. I love supporting people and just really helping people to find information to be as successful as they can within the story that they have. So we don't all have the same stories. Some of us have very, very different health experiences or experiences with our babies. And it really, really does, it really impacts our breastfeeding experience and what that looks like. So I've helped moms who have breastfed babies who have come home through adoption, where the mom did not give birth to her child. And I help people who, I've done some studying of people who are co-nursing, so in the same-sex relationship where both mothers will breastfeed their babies. And then recently done some sort of study in transmasculine or gestational fathers chest feeding, and lots of different things. So also moms maybe who've had breast reduction, or moms who only nurse on one side, or moms who have breastfed triplets or tandem nurse. So lots of different people, lots of different success, all different in the sense of it's not just maybe an exclusively breastfed relationship, and maybe we have to employ some other things. But I really, really want everybody to remember that the definition of success must be defined by the individuals within the relationship. I don't think we can all look at it and say only success looks a certain way, because it really doesn't. And some people combination feed and do all sorts of things. And if that is what's right for their family, then that is success. So I always like to go over some evidence-based resources. One of the things that I see in the work that I do within my community is we are a culture that is inundated with information. We have information all day long streaming at us from many, 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 many different places, Instagram and Facebook and Twitter and Google and all the words that I don't, right? There's just a lot of it coming from all places, and also coming from each other as peer groups, and coming from our parents or our sisters or our aunties, our cousins, our own family, and having varying degrees of information all coming up at that person at one time. And some of this information is awesome, and some of this information is not awesome. Some of it is misinformation. Some of it can be actually dangerous to a breastfeeding person and or her baby. And some of it's outdated. And we don't always know where is the best place to go. Like if I was going to look for something, what would I do? So part of my job in my community and in my role as a doula is to help people to become educated about what resources are like some of the best resources that you can start with. So what is an evidence-based resource? An evidence-based resource is just exactly what it sounds like. That means evidence is backing the information that is being shared. So I love to go over some of those sites, and I really, really hope that people who are listening to this will save these links or investigate these links. So what we don't want people doing is, I have sore nipples and just Googling that. So you'll get, I don't know, 8 million hits that talk about sore nipples. Some of them will be really, really awesome, and some of them may be very harmful. So what I would prefer people to do is go to a resource, an evidence-based resource. And I'm going to go over a couple of them right now and a few books as well, just so that we can always start off with some good, solid background or good, solid, like a scaffolding or a skeleton that we're going to build where our information can be plugged in. So there was a time where most or all human beings were breastfed, where all birthing people would breastfeed their babies. And if they were not able to breastfeed their babies, other women in the communities would breastfeed their babies. There was a time in our history where we didn't have options of other types of non-human milk substitutes and those sorts of things. And everybody was born into or grown up in a culture in which breastfeeding was the norm. By the norm, I mean something that we would see every single day at every single table in every single marketplace by every single birthing or family with new children. We would grow up in that, seeing it, and really be raised with a very, very, very solid understanding of how lactation worked and what happens, how are little people, what gets them to the breast, and how do I know when things are going well. So in that time, people didn't have books and they didn't go to classes. They just knew because they grew up together with other people, right? You've seen people breastfeed. People would have families of 10 or 15 babies. And there would just be a lot of babies, and there'd be like kids 7, 8 years old, and there would be teenagers, and there'd be people starting their period, and there'd be grandmothers, and people would hang out together and they would see this whole sort of fabric and they would learn about it. In our culture now, we have very, very, very limited areas in which we are teaching that type of information or wisdom. We often see, it's not that we don't see breasts in our culture, it's that we see breasts in a very sexualized manner. So we're not talking about breasts as a functioning organ or also part of the mammalian birth cycle. Lactation is part of that cycle, but we don't see it and we don't talk about it. We're very squeamish in our culture about breasts as functioning organs, but not so squeamish about them as sexual objects. So this is really, it gives us a very twisted idea about breasts and lactation. So anyway, I have digressed a bit. I'm going to talk about some resources. And the reason why I'm talking about, I'm going to just tie that up, is because even though we think about breastfeeding or we talk about breastfeeding when we're pregnant, there's very little in our world around us to help us understand. We have limited time with care providers. Our doctors that may be caring for us during pregnancy, our midwives, other people may have limited or very, very, very skewed ideas around lactation. They may have not ever breastfed a baby, or the information that they have may be outdated. Like I said, there's very limited information that is taught to doctors about breastfeeding. Like it's not like they have 2 weeks on lactation in doctors being trained as a doctor. That's not what happens. It's really only a couple of hours when we're talking about human lactation. But yet we say to people, talk to your care provider. We're really setting people up to fail if the care provider does not have additional information about lactation, and they're the ones supposed to be helping. Anyway, I won't bash anybody because I know people really are trying to do their best. So let's talk a little bit about where would I find information that was evidence-based and accurate. So I'm going to start with I always start with books because that's sort of my first love. And then I'm going to go into some videos that we have linked at the end of this podcast, and also some online resources and some resources in your community that you could connect with. The Womanly Art of Breastfeeding is one of the books that I have 9 copies of this. So every one of the families that I serve as a birth doula, this book is always included in that opportunity for people to read. Every time I find one, I have to buy it, and then I just give them to other people. So if you are pregnant or you are new to being a mother and you have not seen this book or read it, I cannot encourage you enough today to find it in a Kindle version, an audio version, or a hard copy like this. This is La Leche League's publication, The Womanly Art of Breastfeeding. And it is written in a very, very friendly type of way. There's pictures and anecdotal type of stories of people sharing their information. It goes right from birth up until weaning an older child. Do you have a question, Carly? No? You're good. Okay. So it goes up, how do my birth choices impact my breastfeeding relationship? And how can I become prepared for breastfeeding? So the very, very first thing, how you can become prepared, is become educated. And this book is always on my #1 list for everybody. It's a friendly read. It's written in a really, really kind way. And it also, Carly and I are going to love this, but what it really does is it also returns the power to the birthing and the breastfeeding person. It's not written in a sense like I'm an expert and you don't know anything. It is written from the stance that you know your baby best and you know your body. And then from there, we're going to build on that. So it returns the power to that birthing person. And I love that about putting the breastfeeding person or the mother in that empowered position and the authority about herself and her child. So the Womanly Art of Breastfeeding, this should be for everybody. If you're looking for a shower gift for a friend, this might be what I would suggest for people. It also comes in a Kindle version, and it comes in an audio version as well. And it goes right up, like everything is in here. Mastitis, plugged ducts, galactoseals, diarrhea, introducing of solids, baby-led weaning, medical reasons for weaning, all sorts of things. So anyway, I would just really go on about this all day, but this is the #1. One of the other books that I really think is awesome is Ina May Gaskin's Guide to Breastfeeding. Ina May Gaskin is a midwife from the United States. She is quite a senior person now, but was instrumental in really shifting the narrative about midwifery care in the United States, and quite a very powerful birth activist. Anyway, her breastfeeding book is just like she is, quirky, highly brilliant, and informative book, and has some really, really, really interesting stories, like stories about spontaneous lactation, and stories about grandmothers breastfeeding their grandchildren, and stories from around the world. So anyway, I love Ina May Gaskin's Guide to Breastfeeding. So any lactivists out there, this is a good read. Dr. Jack Newman, I got to go this way. Dr. Jack Newman is awesome. He is super, super, super fiery, highly outspoken, opinionated, brilliant advocate for women and children and breastfeeding people. He is a Canadian individual, and he operates a clinic back east. We're going to include, after the podcast as well, a tutorial with Dr. Jack Newman, and also a link if you wanted to contact a lactation consultant from his clinic. You could actually work with somebody there if you needed to. I've known a number of people in my community that have talked with people from there and have been very, very well served. So Dr. Jack Newman's Guide to Breastfeeding, an exceptional resource. It is written a little bit differently. There's a lot of words. So if you're looking for a really friendly read, this is a little bit more in depth, but very, 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 very awesome read. And very, very well researched. So Dr. Jack Newman, and he also has a website and videos that we're going to talk about as well. And then this one, this is Nancy Moorbracher's Breastfeeding Solutions. This is a small guide. It's like a troubleshooting guide. It's a pretty easy read, but it's not something that you have to read cover to cover. It's something that you would carry with you or have at your nursing station, and then you would just troubleshoot. So your baby is not gaining enough weight. So you would just go there and you would read that area. So you don't have to read the whole thing. It has some very, very, very exceptional information. And it also has an app by the same name. So I think it's called Breastfeeding Solutions, and I think we're going to share it in the comments. If you're looking for a breastfeeding app, please be wary of apps that talk about how long the baby's at the breast. Really sort of something that's really hyper focused on time. When babies are breastfeeding, it's not really about. We can get very fixated on time and not really notice exactly what the baby's doing. So it's better to have good skills about, is the baby drinking and swallowing? The baby could be at the breast for 40 minutes, but if they're not swallowing, they're not getting much food. And I think that's some of the apps that I see can be very cumbersome to people, especially when moms may be having anxiety and or depression. They can become very fixated on timing feeds or what time the baby's going to the breast, and really get lost in that. So Breastfeeding Solutions, and the app, I think, is about $2.99 or something. It's awesome, and it isn't. It's fixated a little bit differently in a more supportive way. So if you're looking for an app, this might be one for you. And the book as well is awesome. So let me see. I'd like to talk about as well some videos. So we're in a very cyber type of world now, where actual reading in a hard copy or books, lots of people don't love that. And I do always like to include videos and those sorts of visual opportunities for learning, because it can be a good marriage between what you read in the book and what you see. So you're reading it in Dr. Jack Newman, you're reading it in the Breastfeeding Answer book, but then you can see it, and this can help. So some of the really great videos that I love to share, and I do share with every single one of my families and every prenatal class I teach, are these. There's a collection of videos by Global Health Media. They're done by a beautiful, they're narrated by a beautiful Indian woman, and they are made specifically for developing countries. So the way that the information is shared, it's not all sort of shiny and glitzy, just so you know. But the information in these videos is some of the most exceptional information that I have seen, with the best graphics and right up close feeding and seeing. So there's a collection of 9 of them. How do I get the baby deeply attached to the breast? What do I do if I have sore nipples? How do I tell if the baby's getting enough? What if I have breast pain? And all sorts of things in there in these 9 videos. And they're also very doable. So each video is anywhere, I would say, from 6 to 10 minutes. So it's not like you're going to watch for 2 hours. It's a short video, and it's going to give you some very important information. They're going to show you an animation in some of them, and then they're going to show you moms actually getting the baby to the breast, and then they're going to go right up close so you can see the baby sucking and swallowing. And they even show what that looks like inside the baby's mouth through animation, which is really awesome. So that's Global Health Media's videos, 9 of them for breastfeeding. Dr. Jack Newman's website, International Breastfeeding Center, has a lot of videos on there for live video feed. So what does it look like when a baby has a good latch? What do I look for? How can I tell my baby's swallowing? This is the other thing. Like I said, the baby can be at the breast but not be swallowing. So this is important information to know. So it actually shows you videos of, this is good eating, like this baby is eating well, and this baby is not eating well. And then after you see this a few times, you just get better skill. Now, once again, remember, in a more primitive time, we would see hundreds, like in our village, we would see babies breastfeed every single day. And it would be nothing weird to walk up to an auntie or cousin or women at the market and see their baby at the breast. So we would be literally steeped in that knowledge. So we wouldn't have to go looking for it, because we would already have seen it so many times, and we would already know what that looks like. Anyway, the good thing about this time in history is that we can see these things online. But generally, if you were at Earl's and there was a mom breastfeeding and you were pregnant, you probably wouldn't walk up to her and say, "Can I watch your baby, nurse?" Which is really sad. But anyway, that's how we used to learn, right? So part of it, learning about breastfeeding, is instinctual and sort of in our hard drive, but lots of it is a learned behavior with other people and watching them. And because in our culture, we only see breast sexually, but we don't see baby at the breast, we really are missing a great deal of opportunity to learn. So Global Health Media, Dr. Jack Newman's website, incredible videos. So do check that out. Nancy Moorbracker as well has a YouTube channel. So how do I get my baby to open wide? How do I get my baby to tilt their head back more? How I have an overactive letdown. How do I get the baby to nurse comfortably at the breast if I have a very strong, forceful letdown? What does laid back breastfeeding look like? What are some breastfeeding positions? I have big breasts. How can I breastfeed? So Nancy Moorbracker has a YouTube channel, and a lot of those things are handled there. Once again, she has many years expertise in the field of breastfeeding as an IBCLC. IBCLC is internationally board certified lactation consultant, and that's a person that has taken additional training specifically for lactation and pathology of lactation. So I have a title of a breastfeeding counselor, but I am not a lactation consultant. So it's good to know that the people out there who are putting that information out are very qualified. So Nancy Moorbracker. Then there is educational opportunity that I stumbled across a year and a half ago. Cindy and Jana from Saskatchewan, so in our province, a couple over from us, have put together a class called Simply Breastfeeding. Cindy and Jana both are registered nurses and have IBCLC sanction as well. So they worked in public health and on maternity floor. Both of them cumulatively have, I don't know, probably 40 years experience or more. And they have put together a website, articles, and educational components for breastfeeding and for postpartum. Their information that I have sat in on and watched, every single thing has been very congruent with other evidence-based informations. And they have this wonderful breastfeeding course. I think it retails for around between 40 and 50. It has 14 modules that you can, once you purchase it, it belongs to you, and you could watch it over and over again or at different times. And I once again suggest this to all my birthing families that I work with as a doula, and I give out that resource often because I know that their information is good and that they are giving it in a way that's not overwhelming for people. So that's Cindy and Jana, and the course is called Simply Breastfeeding. And the other one that they have was, I think it's something in the postpartum. I'm sorry, I don't know the name. I have taken that one, is exceptional as well. So what to expect in the postpartum bleeding, blood clots, cramping, stitches, umbilical cord, like all that sort of stuff that you will need to know in the postpartum period. They have a course as well. That is lovely. So I would strongly and really without hesitancy recommend that course to people. There's also the Leche League in most communities, or many communities across the globe. So La Leche League is a grassroots organization. Every single person that is a La Leche League leader has to have breastfed a baby. I think it is 10 months or more. So every single person has been a breastfeeding or is a breastfeeding person or mother. Right now, that's more information than many healthcare providers may have. Let's just say that. Those people already have breastfed. Maybe some of them have breastfed 2 or 3 or 4 children. So they have a lot of information. They're not IBCLC certified, but they have exceptional information that will carry you for most of it. And if you need additional types of support, then they would help you connect with an IBCLC if you needed to. So I'm not sure how people are meeting in COVID. There may be online meetings like that, but La Leche League is an exceptional resource for mothers to go. Now, please don't wait until you are in the crash and burn mode before you reach out. This is something I see all the time. I don't reach out for help until I'm literally crying on the floor or crying at night at 3 o'clock in the morning with bleeding, blistered nipples. And then I really barely even have the bandwidth to reach out. So if anything today, if I can give you one thing, if you only remembered one thing that I share with you today, I think this would be it. Please reach out early, and please set up your support networks way before your baby is born. Start educating yourself way before that happens. And often I see people come to the Breastfeeding Cafe and they're having problems, and they've been having problems for 6 weeks, but they didn't know how to reach out. And we can all really do much better when we have a community. So it doesn't mean, being educated does not mean that you will not have challenges, but what it does mean is that you will have more tenacity to move through your challenges and you will know where to get help when the challenges visit you. So La Leche League is an awesome opportunity to educate yourself about breastfeeding. Also, you can see people breastfeeding their babies, right? You're sitting in a room, a circle of other people breastfeeding. You see them holding their baby, breastfeeding, those sorts of things. And lots of information is transferred to you just by being there in that room. And then you hear about people's stories as you go around the circle. This person had plugged ducts. This person has a nursing strike. This person is breastfeeding tandem. This person's breastfeeding a 3-year-old. So there's just so many stories that happen that you're exposed to in that time. So that's awesome. I cannot say enough about La Leche League, as it was my sort of my home where I really fell in love with lactation and became really passionate about it. And it really has quite an interesting sort of foundation of parenting that I really found helpful. So those are some of my favorite resources. There's a couple other IBCLCs that have sites. Milk Meg, who's super fiery and has some really, really awesome, funny, but really informative, supportive things. So her name is the Milk Meg, Meg Nagel from Australia. She's an IBCLC. Lucy Weber and Lucy Ruddle, the two Lucys who are from the UK, have exceptional videos as well. So once again, what I'm saying is, please don't just Google. Go directly to evidence-based sites first before you ask everybody else. So that brings me, I didn't talk about this last one, my other very, very favorite website. I'll talk just about a couple of those. KellyMom.com, my #1 go-to. Whenever anybody has a question, I'm going to share from there. So KellyMom.com has a very, very easy website to use, evidence-based information, bang on, spot on. That's the place to go. Go there first. Then you could go to lalecheleague.org. We'll share those in the background. And both of those informations are going to be very similar. So you're not going to read something on Kelly Mom and then read something on La Leche League that's totally different and opposed to each other. This is a problem for many people. I don't know who the hell to believe because this website said this person said that, and the nurse said this, and the doctor said that, and I really don't know what to believe because I've never done this before. So it's good to find information that's congruent and information that it feels comfortable. So kellymom.com, always my #1 go-to, and then lalecheleague.org.ca, any of those things, once again, evidence-based information, those are awesome. So I wanted to go in a little bit now about, I know that Carly said that some people were wondering about health benefits for the breastfeeding person. So we talk a lot about human milk as a species-specific food and nutrition for our offspring as being the perfect food for our babies. Also, I don't want anybody to feel that I'm bashing formula. This is not my goal. It's awesome that we have formula. It has saved many lives. And I'm not here to make anybody feel bad about using formula or formula feeding or any of the sorts, because that's not what we're about. Everybody needs to make the best choice that they can for the story unfolding. But I am a lactivist and I'm passionate about lactation, so I'm going to talk about human milk. So initially, the benefits that we talk about lots in our culture are really geared towards our babies and how it benefits them. And really, I have been studying breastfeeding for a long time. I could probably talk about weeks about how there's benefits too. But today, for a brief little bit, we're going to talk a little bit about some of the breastfeeding benefits for the person who is breastfeeding. There's been a little bit more study. Breastfeeding doesn't always get a lot of research dollars because we don't make money from breast milk. People can't sell it. They can't market it. So it's not like they're doing a whole lot of research all the time. So there has been studies done, and La Leche League and those guys have a lot of that types of information, and I'm going to share with you a little bit about that. Breastfeeding for the person who is breastfeeding has benefits not only during the time that you are breastfeeding, but for the rest of your life. The cumulative years that we spend or months that we spend breastfeeding helps protect us in many ways, and some of them would be reduced likelihood or incidence of breast cancer. So the longer you breastfeed, they have some type of equation. I'm not a math person, but the longer we breastfeed, the less incidence of breast cancer that we see. So I'm not saying that it's 100% guaranteed, but when our breasts are allowed to function in the purpose of what they do, there's a reduced incidence of breast cancer. And we do know that breast cancer starts in milk ducts. That's where it starts. So, and when you've breastfed 2, 3, 4 years, if you have, then I think it's every couple of months, the number of incidents or the protective incidents for breast cancer goes up. So this is good. So you can imagine at a time where most people were breastfeeding, and they may be breastfeeding for a great deal of their adult life because they may have bigger families, that the incidence of breast cancer in those times was probably a whole lot less. We've seen a very, very huge decline in breastfeeding across the board in North America for many, many reasons, which would be a whole nother discussion, Carly. We would be there talking about that. So anyway, incidence, it decreases the likelihood of breast cancer in the breastfeeding person. It also decreases the likelihood of cancer in our reproductive organs, so in ovarian cancer, uterine cancer, those types of things. Some of the reasons are that when we are breastfeeding, there is we reduce cycling, so we don't have as many periods, and that can have some protective factors for us as people who have a period. And that's because of the experience of the hormones in our body. So there can be a reduced incidence of ovarian and uterine cancer. There's also evidence now about reduced reactive types of inflammation in our body. And I know that Carly has shared a number of the TED Talks that we've sourced out that talk about heart health, reduced cholesterol. And there is even most recently some suggestion that breastfeeding can have a reduction in Alzheimer's. I'm not sure yet how that works because I have to read a little bit more. I've only seen it mentioned a couple times. And I don't really know the logistics, how that works. But it's important to know that breastfeeding affects our bodies, not only during the time of lactation, but far into the future as well. When you're breastfeeding, the calcium that goes into the milk is leached from our body. So we want to make sure that we're healthy and doing the best that we can. That doesn't mean that if we're not eating perfectly that we can't breastfeed. But one of the benefits as well is that when we stop breastfeeding, our body has the ability to lay down calcium at a much greater rate than if we didn't. So it's not a damaging effect. Our body is meant to do that, and then it has an ability to build up calcium in our bones much quicker than it did before. So that's interesting as well. There's also studies and suggestion about heart health. So women who breastfeed have lower levels of cholesterol, and it can be very, very beneficial for stress reducing. I know some people might be saying that was not my story. Breastfeeding really caused me a lot of stress, and it's true. If you're having breastfeeding problems, it can be quite a source of anxiety for people. But when it gets good and we are breastfeeding, it can be super helpful in those ways. Another way that breastfeeding can help people, especially in the postpartum period, is that a successful breastfeeding relationship for people can decrease depression and anxiety, and also help people to get more sleep. Now, I know also people will be thinking that's ridiculous. I was up 12 times with my breastfeeding baby. Studies suggest that breastfeeding mothers get 30 to 40 minutes more sleep. Now, it depends, right? We're not all in everybody's home. This is when you add up a whole bunch of people and you take, Carly would know, but you're going to take an average, okay? Somebody's going to be way on this side and somebody's going to be way on this side. But they are saying that breastfeeding mothers do get more sleep. Also, we don't have to get up and turn the lights on. We don't have to heat something up. We don't have to wash or sterilize something. So there's benefit to us in that way. Not to mention, I used to say breastfeeding is free. And now that I'm not saying that anymore, because that completely erases the thousands of hours of dedication that each breastfeeding person puts in. So it's only free in the sense that we are not paying money out for it, but it is something that we have to show up to do. So it is a reduction in how much household budget is leaving. So that can be a good thing. Like I said, the podcasts that we have shared, the TED Talks, they'll go over a couple, like quite a few other types of benefits. We do know that there's People have better levels of hormones when they're breastfeeding. They have less bleeding when they're breastfeeding. So the oxytocin that is released during the time of breastfeeding causes uterine contractions, then we're bleeding less. We do have higher levels of oxytocin when we're breastfeeding, when the baby's at the breast, and that helps us with attachment and bonding. So all of those things, although they are benefiting our offspring, they benefit us as well. I think that's probably good there. Carly, do you have any other ones you want me to speak to?
No, I think that's pretty much good. Now we could probably talk a little bit about dealing with the actual problems, because I myself, being highly educated and being even immersed in the birth world and hanging out with lactation consultants and doulas, I thought, well, I had one baby already and breastfeeding went fine, so I should have no problems. And then Michaela, being my little wild card, decided that she was going to have latching problems, and I had the cracked nipples, and I had the mastitis at 15 months, which really threw me for a loop. So yeah, absolutely. One person has said, before my baby, I didn't know how to set up my support network, and COVID made it impossible. So I can actually speak to that, because that's what Empowering Moms does, is we set up your support network for you. We figure out what's important to you, and we go over all that in our sessions, just what support you have for your care provider, how to set up the best care provider for you, how to set up support for a doula. If you're going to want to find a lactation consultant, which I absolutely recommend, I would have all that set up. So once your baby is born, you know who to call. You know where to find those resources. That was one thing that saved me, is I had a lactation consultant that I could just call up. My daughter had just been born, and I'm like, I'm having problems with her latch, and can you come out? And it was not even 24 hours after she was born that I had that help. So Jocelyn, can you talk a little bit about the challenges that moms face?
Yeah. Thank you very much for that question. I have been actively in a doula role during the time of the pandemic and continue to offer breastfeeding support. So I 100% agree that the ability to connect with individuals and to get a support system is totally a different situation. A lot of the helping types of things have gone online, and it is not perfect. What we're doing right now is not perfect, but it is still awesome in the sense that we can meet people and chat with people. So I would encourage people to find out resources like we talked about, get some of those books, plug into some of those sites, watch those videos, but also connect with a group of women who are successful breastfeeding. So what we're doing is that when we go to the doctors, they're not telling us this. Maybe our midwives maybe are not maybe telling us these sorts of things. And then when we have the baby, we're pretty much left sort of on our own, and we're just waiting for postnatal appointments with our care provider, which is never really enough. So a group or network of people who are successful in breastfeeding and can give you good support, as well as those resources, can help. Because there's a thing about learning through a book or a video, and then there's talking to other people and hearing their story, and those things both work together. And we can't cry to the book when our nipples are bleeding, but that support group of women can hold you up and encourage you to keep going. So it is really important to have both. And like I said, La Leche League meetings online, Breastfeeding Cafe, those types of things. Many communities have transferred their support services to an online venue, and they're usually fairly inexpensive also, so usually under $10 for people to attend. And like Carly has said, the opportunity to connect with a internationally board certified lactation consultant and those online educational programs will really help people. But please don't forget, we need flesh and blood support, and we need the educational resource support as well. One by itself is good, but not quite as good as when we have both. And to the people who are birthing right now during COVID, you have to be quite a bit more tenacious, which is hard right now, especially in a postpartum time. and we're anxious. But there are resources out there. Please connect, talk to people who know and who can point you in those good directions, and then get to the meetings. They're usually 1 or 2 hours, and they have an opportunity for people to ask their questions and become educated, and then connect you with additional resources if you need to. So let's talk a little bit about how lactation works, and then I'm going to go into, so lactation. When we're entering puberty, we have a breast increase. This breast increase is actually lactiferous tissues being built in our body in preparation for the time that we will have babies. Even though that we are not necessarily having babies at 13 years old, when you start your first period, you are technically, as a mammal, ready to have babies. Our body says, I'm ready to have babies, even though we're not in this culture. But that breast increase, that growth, is the changes in puberty, and they happen because of the hormonal shift in our body. So people start actually being prepared for lactation way back then. When you become pregnant and there's a fertilized egg that implants in your uterus, there is again a breast increase or growth for most people, not all. What is happening then in the early days when you start feeling that breast tenderness, that is actually lactiferous tissue being grown in your body. So lactiferous tissue is the tissue. So inside our body, it isn't as perfect as this, but what we're feeling and the actual breast increase is the growth of these little clusters. So these are clusters that actually create the milk here, and then during the letdown, these little clusters constrict and then push the milk down into this area where the baby can latch and get onto the nipple. So when we're in early pregnancy, that breast increase is because of lactiferous tissue growing. Now, sometimes people won't notice this, and sometimes there are some individuals who may not make enough lactiferous tissue to lactate. And I don't know if I'll have time to talk about that, but I just want you to know, if that's your story, that does not mean that you don't, if you still want to breastfeed, that you can breastfeed, but you may just need some support to do so with supplementation or an at-the-breast supplementation system. So initially, your body makes this lactiferous tissue, then it sort of goes on hold. Around 16 weeks of pregnancy, our body starts to make colostrum, which is the first milk. It is sort of like really, really yellow, thick liquid gold, they call it. It's measured in teaspoons. There's not ounces of it. You might notice crustiness or sort of a discharge at your nipple around that time until your baby is born, and that is colostrum, which is incredibly rich in protein and immunological benefits for your baby. It also coats the gut of the baby so that proteins don't pass back and forth, and reduces allergies, and it also helps the baby to poop. When we have our baby and their baby comes out of our body, whether that be cesarean section or a vaginal birth, the thing that triggers the next part of lactation is the birth of the placenta. So as long as the placenta is in your body, or a piece of the placenta in your body won't make milk. Once that placenta comes off the wall of the uterus and is expelled out of the body, that signals the body there's a shift in hormones over the next couple of days, and that says to the body, hey, our baby was just born, now we have to make milk. So initially, lactation is driven by a hormonal shift or a hormonal balance in our body. After that happens, the milk starts to come in around day 3 to day 5, and then after a certain point, it is the removal of the milk that continues the milk to be made. So initially, lactation is driven by a hormonal experience, and everybody will make some milk after their baby's born, whether they breastfeed or not. After so many days, the thing that drives milk production is the supply and demand feedback. So feeding the baby frequently at the breast tells your body, I need you to make this much milk. That's how that works. So it's important to understand how lactation works, because if we don't understand how it works, we can often be confused and stuck in ideas where people say you have to space out your feedings, those sorts of things, which would be actually the opposite of bringing in a full milk supply. You want to breastfeed as often as possible. I like to tell people 10 to 14 times. Many of the books say 8 times, but this is what happens. People say, well, I done 6, so that's pretty close to 8, so that's good. But actually, I would say shoot for 10 to 14 times in a 24-hour period to bring in a full milk supply. If you can understand how it works, then you can begin to make decisions in your life that support lactation, as opposed to making decisions in your life that are not good for lactation. Things like supplementation or soother use and those types of things can, for some people, really impede their milk supply or cause problems at the breast for their baby. And once again, I'm not here to tell people what to do. I'm just saying if there's extended periods of separation between mom and baby, or a baby does not go to the breast frequently enough, then the body says, I guess I just don't need to make that much milk. So it's important that the baby goes frequently in order for the baby to learn how to breastfeed and for their body to be regulated at the breast and your body to communicate and make milk. We have to do that and breastfeed frequently. That brings me to my next piece, avoiding difficulties. So there can be a number of different types of difficulties that people can experience in breastfeeding. I like to say this: it's not that you might have difficulties. It's not that you might have challenges. You 100% will have challenges of some sort because it's a breastfeeding relationship. And the idea that we would have a relationship without any challenges is that's not realistic at all. You will at some point have some challenges in some way. Once again, the better the education, the better the understanding, the better the support group, the more able you will be to move through that challenge. And that doesn't mean only an exclusively breastfeeding relationship. That means you will know about other alternatives to maintain what you can at the breast and then supplement in ways that you can if you need to do so. So Carly really wanted to talk a bit about plug ducts and mastitis and those types of things. So when milk first comes in the first 3 to 5 days after the baby's born, especially for first-time moms, we can notice an experience called engorgement. And engorgement means just a lot of fullness of that area. So engorgement can happen right at the clavicle, under the armpit, and right, like your whole area can be quite firm and full and hard and exceptionally sore. The good thing about engorgement, it only lasts about 24 hours. And that's not only milk that's doing that. There's a lot of fluid and lymph and other sorts of activities in our body that go towards that engorgement experience. And actually, we don't see it as badly in other babies. After you've had one baby, the engorgement is not as bad as it was the first time. So it's something, the way the body gets up and going. Engorgement can be helped by a bit of cabbage leaves. So putting a cabbage in the fridge and then taking cold cabbage and putting it around your breast in your bra for a limited amount of time. So you don't want to use a whole bunch of it because it can actually decrease your milk supply. But if you're having a lot of soreness for a couple hours, it can be helpful. You could hand express a little bit to relieve that engorgement and really, really work on getting a deep latch, which some of the videos and things can help you. And if you need additional support, please don't wait. Go see a lactation consultant before things are bad. So plug ducts, mastitis are all sort of connected to engorgement or skipped feeds, or in Carly's situation, a person who has a very large amount of milk. So some people can have a really large amount of milk and some people can have not enough milk. I wish we could sort of switch it together and we could trade a bit of that. But if we have a very, very large amount of milk, or a baby who is sleeping through a feed or a separation from a baby, say it's Christmas time, there's a lot of people over there holding the baby, passing them around, we often see increase of mastitis or plug ducts at that time. So anytime the milk is not removed from the breast. So what's happening is these little things get very, very full. And if there is like a bra pinching, or you're sleeping with a blanket bunched up here, or when you nurse, you're pinching your breast and blocking some of that drainage, you can have a mastitis or a plug duct. So what's the difference? A plug duct is exactly that. There would be maybe some thickened milk, or there would be maybe a milk bleb or a blister on the edge of the nipple where the milk can't get out. So the milk is stopped up in there. And what that does, then the body gets irritated by this milk being stuck there, then it becomes inflamed. So a plug duct, you might feel a bit of lumpiness in your breast area, and it can feel a bit sore. A mastitis is a plug duct that's gone a little bit further. So it would be a plug duct that hasn't been fixed. It can also come to people around the time if they have other types of viruses or colds. And a mastitis is really, really, really sore. Often you'll have some reddened area where you can see it visually on the breast. You may have red streaks, and it's super, super, super painful. You often will have a fever and chills, and you will feel like you were run over by a truck. It is a terrible, terrible experience. And in most cases, people will need some concerted effort to get that fixed. So some people may choose or need to use additional medical services like antibiotics. And sometimes we could hand express that a bit. So heat, massage that area, hand express, or put the baby to the breast and get your butt to bed. This is the other thing. So mastitis and plugged ducts say, slow down, put the baby to the breast and rest. And if you need additional medical services, to reach out for that. I often see people are super busy in that postpartum time, and then they get mastitis because they're just like, they're driving kids to school and they got this seatbelt over here, or they got the baby backpack on and the breast is being compressed, and then we can often see mastitis at that time. So a plugged duct is marked by just a lump or a sore area in the breast, but you don't feel sick other places. And generally you're going to do the same, though. You're going to heat with some heating pad or a rice sock or a shower. Then you're going to massage that area, but not to hurt yourself, firmly but not meanly. And then you're going to move that milk out until you actually see it. Sometimes you'll see like a thick, like a spaghetti, like a long piece of thickened milk come out, and then make sure you do that and then continue to breastfeed the baby as often as possible. And yes, even if you have pus in your milk, you would continue to breastfeed the baby. Please do not discontinue that. And that's what sometimes people are told, but you do not have to. And actually you shouldn't, because a pump will not do as good as your baby can. Mastitis is marked by similar symptoms, but flu-like symptoms as well. Fever, people can feel nauseous, they feel achy, those sorts of things. And those we can see in early days of breastfeeding, or like Carly, even a 15-month-old baby. At any time that we are lactating, we can have mastitis or plugged duct, anytime. So it's something that you want to be on guard for, and do take care of yourself if you see those sorts of things. And remember that resting is important. Sometimes we get really, really too busy. One of the other things that I want to talk about, avoiding difficulties, we're running out of time, would be low milk supply. So sometimes low milk supply can come to us because we may have insufficient glandular tissue. We may have polycystic ovarian syndrome. We may have had a bleeding disorder. We may have diabetes. Some of those things can exacerbate or cause that. Other times it can be excessive soother use, separation of mom and baby, poor latch, those types of things. So what's happening is the biofeedback loop between the breastfeeding person and the baby is not great. And then that tells our body, I only need you to make this much milk. So that's why supplementation, if we don't need it, can cause a problem. Then the baby spends longer time away from the breast and the body just adjusts accordingly. So a body only knows to do what we are communicating with it. It does not know that we have a 3-day-old baby. If the baby is not visiting our breast and not going frequently enough, our body can't just keep making milk, like it will stop. So it has there's an inhibitor built in that when the breasts get to a certain fullness, the body is signaled then to stop or slow down making milk, and that can take a number of days to get back up again. Or in some situations, it could tell our body we don't need all that lactiferous tissue, and some of it will go away. So low milk supply is another difficulty. I'm just briefly going to touch on that, and then I'm just going to finish up because we're coming to the end. Other problems that we may experience would be sore nipples. Sore nipples can be caused by this, a poor latch or shallow latch. So when a baby gets on, they must take much more of the breast tissue and then flatten out the breast tissue and bring the nipple back to the soft palate. If the baby is just on the tip of the nipple is then compressed and crushed into the bony palate, and it's actually just like being pinched for like 20 minutes in a really nasty way. This hurts badly. So we want to encourage a good deep latch. And sometimes it can be anomaly in the baby's mouth, where we're talking about a tongue tie or lip tie, a posterior tongue tie, a high arched palate, a mother whose maybe nipples are a bit flatter so the baby can't get on as deep or needs a bit more help. So there can be situations in the mom or the baby that can exacerbate a latch issue and cause sore nipples. And I would have to say that the majority of time these situations can be fixed, but you do need some support. So if you are feeling that you have pain, blistered nipples, bleeding, scabs, that is all a sign that you need additional support. There can be a tiny bit of discomfort when the baby first goes to the breast, but it should not be painful. And that is, then we just talked, that's nipple damage, where we have actual pieces. Some people have pieces missing. from their nipple, and they're actually can have some blistering and that sort of thing. It's a very, very, very painful. And then the next thing that can happen, it would be a premature weaning. I mean, there's lots of difficulties, but we only have so much time. But sometimes when we don't understand how lactation works, some of the things that we're doing are actually causing us to move towards a weaning before we're ready. So encouraging long sleeping, encouraging babies to sleep throughout the night when they are still breastfeeding can decrease our milk supply, those types of things. So once again, once you understand how lactation works, it's easier to understand why my baby still needs to nurse at night once or twice. If I'm pumping, I still need to pump at least once in the nighttime because I'm communicating to my body that I need you to make milk. So that's pretty, I'm at 4:54. I don't know, Carly, what do you think?
Just to speak for the shallow latch, like my son, it was very simple. He just latched on himself. I never had any issues with his latch. So even if you are a seasoned mom,
yes,
and you have all the breastfeeding knowledge, you've been reading all the books, there is still a chance you're going to get given a wild card.
Yes.
My daughter was my wild card. And knowing that she had a shallow latch didn't solve the problem of me still having those cracked nipples. And I'm like, this sucks.
Yeah.
Like, this really sucks. Yeah. But I knew that it was temporary and I knew how to handle it and I knew to go out and get the help. And if you're thinking, well, I don't even know where to find a lactation consultant, I don't know where to look for this information, or what was that link that was dropped in like a month from now, reach out to me. I can go and get it for you. I've got a whole resource library. And Jocelyn, you've actually seen my resource library because I give that to my luminaries as just a gift. It's like, hey, you know, I know how hard it is to go out and research stuff. So here, have my library. So that's part of what I give to my clients is access to that library.
Every pregnancy and every baby is different. Every breastfeeding relationship is a little bit different. So we don't forget how to breastfeed or birth, but different babies, different position, different experience. Our birth experience can be totally different than it was another time. And our breastfeeding can be really different. So it's not necessary that we don't know, but we have a new partner. They might not know what, or they may have other issues. And that's important to remember that you can have little people who they may have some different struggle than your other baby did, but it doesn't take away your knowledge that you already have. And then you know where, like you did, to get help. That makes a difference. 100%.
Yes. Well, I think that even if I had a third, I would probably still have a challenge or two. However, being within the luminaries community, I also know that I have so much more support than I did. And that's one of the things with Empowering Moms is that I offer that support because I know how difficult it is to try and find the village. We don't really have a village anymore.
There's many little clusters of villages that some of them are not as friendly as others.
That's a very diplomatic way of putting it. I would say that's pretty much accurate. But yeah, for even moms in Abbotsford may be better off than moms in Agassiz or Hope.
Yeah.
And having those resources and knowing where to look. One of the things I love about the internet is that we can all gather every week on Zoom and learn from each other. And you're in Prince George.
Yeah.
And I'm talking to you right now. So having that connection is so crucial to being able to have an empowered journey for motherhood.
Yeah, for sure.
And I'm still learning so much too. And I plan to continue learning until I'm like 90.
Awesome. Good. It's been very lovely to be here today, Carly, with you. I hope that was helpful to somebody.
I'm sure it was. It was very helpful to me. It gave me some insight, even in when you were saying you need to rest. I did not rest when I had mastitis. I thought I'm just going to get this clogged duct out and I'm just going to carry on. I did not get my butt into bed. I needed you to be my friend back then because you would have been like, Carly, what are you doing? Get your butt into bed now.
Yeah.
But
Because you can, I mean, it could actually turn into an abscess, right? It's not a joke. Mastitis is a serious health concern, and people can feel very, very badly from it. And then you can actually have like an abscess or pus coming out of your skin. So we need to get care, and we need to get it sorted, and we do need to get to bed for a couple of days.
yes, and that was actually what spurred me to finally see a doctor after 3 days of dealing with it on my own, because it's like it can turn into an abscess. And then I looked up what an abscess is and what the treatment was. I'm like, I don't want that.
No,
I don't want that. So I'm going to get my butt in there and I'm going to suck it up and I'm going to take those antibiotics and I'm just going to deal with it, because I don't want what's going to come down next. If I can't get this done.
And like I said, if you get it early enough and you know what to do, sometimes you will avoid that. But if you are actually feeling quite unwell and you can't get on top of it, it's important to seek help. So get on top of it as soon as something's going on. And the first thing though, Carly, the first thing really is rest. Like most people are too busy. And this is sort of what's causing, there's skipped feeds. There's a lot of soother use. The baby's crying. The baby is queuing to feed, but I just got to do the dishes. And I just got to get this snowsuit. And I just, we just put it off. And then pretty soon we feel badly.
Yes.
Rest.
Take away, get help.
Yes. That's
reach out. Reach out. If you don't know where to reach out, I am here all the time.
Yeah.
There are lots of moms already who have sent me messages and they're like, how do I find this? And I help. So
awesome. Come
and just send me a message and I will get you some help immediately.
Yes. Awesome.
Don't wait.
Are you almost done?
And Hunter's now waiting for us to be done. So this is my first wild card. Okay, so
I'm
Jocelyn,
the first one.
Yes, you're the first one. You're the firstborn. So Jocelyn, I will see you tomorrow in the group for the Luminaries. Thank you so much for coming in today. I really appreciate it, and I can't wait to have you on again in the future.
Awesome. Thank you so much, Carly. We'll see you tomorrow.
See you tomorrow, Jocelyn.
Here.
Bye.
Bye.